Hello everyone, good evening, and you're very welcome to this month's webinar section organized by Pronochus Fair Limited. And this month's webinar topic is self-breast examination. So we'll be talking about self-breast examination, what it means, the process of doing it, who should do it, when to do it, and how to do it properly and correctly. So sit tight as we go through this. So firstly, what is self-breast examination? So this is a physical examination that you carry out personally yourself as an individual, unaided. You don't carry it out with assistance of anyone. It's a very simple technique you carry out, a very simple physical examination that you carry out on yourself in order for you to get more acquainted with yourself. And now we are talking about the breast now in particular. So we are carrying out self-breast examination for you to be able to get acquainted with what your breast feels like, what it looks like. So that's all about self-breast examination. Now, going further, why do you need to do self-breast examination? Why does it matter? Like, can I not just let it go? Of course, no, you cannot let it go. You have to do self-breast examination. The benefit of doing self-breast examination is that with regular self-breast examination, you are familiar with your breast. You are familiar with what your breast feels like. You are familiar with what your breast looks like. You are familiar with what is normal with your breast. So that when there are changes, when changes occur, be it positive or negative, you are able to detect these changes and seek professional medical help when it is needed. Now, what are the benefits of carrying out self-breast examination? It helps you to detect changes, especially negative changes. It helps to detect negative changes early because early detection equals successful treatment, especially for breast abnormalities like breast cancer. Most times you see a lot of persons present to the hospital very late with breast cancer. If these breast cancers are detected very early, if it is detected at the early stage, then it will give successful treatment. But when it's detected late, the treatment most times are not successful. So the benefit of carrying out self-breast examination is that it helps you get familiar with your breast and helps you to detect changes, be it positive or negative. Now moving forward, who should carry out self-breast examination? Most times you hear people say it's for the females, it's for the ladies, but I will tell you that it's for both genders, both males and females, because breast abnormalities can also occur in men, even though it's in a very little percentage. So even you as a male, you need to carry out self breast examination so that you will not be among the little percentage of male presenting with breast abnormalities. So all adults from the ages of 20 should carry out self breast examination. All adults from the ages of 20. And then if you have a family history of cancer, especially breast cancer, you have self breast examination. And also for you to be proactive with your health, you need to carry out self-breast examination. Now, when do you need to do self-breast examination? So for women within the reproductive age, you should carry out self-breast examination within 3 to 5 days from the end of your menstrual period. Now, some school of thought will tell you should do self-breast examination within 7 to 10 days from the start of your menstrual flow. And because of the differences in the number of days of the menstrual flow, some persons they have 3 days, some persons 4, 5 days, even up to 7 days. So because of that differences in the number, it's best that you do your self-breast examination from 3 to 5 days after your menstrual flow ends. That's for women within the reproductive age. Now, for women of menopause age, for pregnant women, for breastfeeding mothers, and for the males, you should pick a date, be it first of the month, 5th, 10th, 20th, whatever date you pick. Pick a date and be consistent with that date every month. If you are working with first of the month, you should carry out self-breast examination on the first of every month. You should be consistent with the dates you are picking. Don't do different dates. Pick a date and be consistent with it so that you will know what is happening at the various points in time. Because at various, especially for the women, at various stages, at various points in time, there are different hormonal changes occurring. So there are different things happening to the breast or happening in the breast at different times. So when you pick an exact date for those women of menopause age, pregnant women, breastfeeding mothers, when you pick an exact date, you're able to know what is happening at that point in time and you're able to detect abnormal changes. Now, going forward, what do you need to carry out self-breast examination? The things you need a mirror, be it half size, full size, handheld mirror. You need a mirror, you need a pillow, then you will need your hands. You don't need to spend, you are not spending money on anything. Just the usual thing you have within you at your house. In your house, you need a pillow, you need your mirror, then you need your hands. Those are the things you will need to carry out self examination, and you should do this at the comfort of your home. You should do this at the comfort of your home, a very private area in your room, in your bathroom, a very private area at the comfort of your home where there will not be any distraction or disturbances. Now, going further, we'll be talking about the steps in carrying out self examination. Because one thing is to do self examination, and another thing is to do it properly so that you can get good results. So, the first step of self examination, step one, that's why you're making use of the mirror. You stand in front of the mirror, look at your breast. When you're standing in front of the mirror, you look at your breast. Firstly, you observe your breast. Visually, with the use of your eyes, you observe your breast with your hands by your side. So you place both hands by your side and then you observe your breast. Now, what are you looking at in your breast? You're looking at for the size of the breast, even though most times, in many persons, one breast is usually bigger than the other, but the difference in size is not much. Sometimes it's not obvious. So you look at the size of the breast, ensure you are checking out for the difference in size of the breast. If it's obvious, then you should seek for medical help. So you're looking at the size of the breast, you're looking at the shape of the breast, and you're looking at the symmetry. Symmetry in the sense that you are checking for the position of the breast. The breast should be under the collarbone. This is the collarbone. The breast should be under your collarbone. So you are looking for the position, the symmetry, to be sure that they are both below the collarbone. Then also you're also looking at for redness, the skin of the breast, the area around the nipple. You're looking at for redness. You're looking at for rashes. You're looking at for dimpling. Dimpling. What do we mean by dimpling? When you peel an orange, you will see tiny, tiny little holes on the orange. Now, those tiny, tiny little holes are what we call dimpling. Now, you are observing your breast for that tiny little holes. They are just like minute, minute, tiny little holes. So you check your breast and ensure that to be sure that this dimpling are not there because it can be a sign. If it's not, it is a sign of breast cancer. So you are checking for dimpling, you are checking for redness, you are checking for rashes, you are checking for crusts, you are checking for swelling on your breast. So after observing your breast with both hands by your side, the next thing you observe with your hands raised above your head, and then you also observe with your hands pressing firmly on your waist. You also observe for the size, the shape, the symmetry. You check for swelling, dimpling, rashes, redness. So these are the things you observe for while looking at. Then the next thing you'll be feeling your breast. That's the step two. The next step you'll be feeling your breast. So this is best done under the shower. So that it's when you feel your breast with your hands, it's slippery and then there's easy movement. There's no friction. So it's best done under the shower. So how do you feel for your breast? You're not using your entire palm to feel for your breast. No. You'll be making use of your three middle finger. Making use of your three middle finger and using the pads of your three middle finger. You're using the pad, you're not using the tips. No. You will not be able to feel well with the tips. So you're using the pads of your three middle finger and then you are going to go around your breast. Now take for instance, I want to feel from my left breast first before feeling my right breast. So I will use the three middle finger of my right hand. I'll use the pads of the three middle finger of my right hand, and then I will feel my left breast. Now, while I'm doing this, my left hand will be behind my head. My left hand will be behind my head in order to expose my armpit because I'll be starting from the armpit region. Of course, you are checking the armpits too. You're not just checking only the breast, you are checking the armpits too. So my left hand will be behind my head to expose my armpit region. And I will take my three middle fingers, using the pads of my three middle fingers, and then I will go around my breast, starting from the armpit region. So I will move in a circular motion till I cover the entire area of the breast from up to bottom, from the armpit to the cleavage region. I will ensure that I cover the entire area. Now, when you are doing this, you start from light pressure to deep pressure so that you can feel the deep tissues. You can feel the deep tissue. So you start from the light pressure to deep pressure. And then when you are feeling when you do this occasionally, you get to observe that there are lymph nodes. There are lymph nodes in the armpit region and around the breast. So for the first time you'll be doing this and then you notice this lymph node, there's no cause for alarm. There is no cause for alarm. There are lymph nodes at the armpit region and around the breast. So when you are carrying out self examination, when you are feeling for it, you will eventually feel the lymph nodes. Now, when you do this self examination regularly, you'll be able to understand and get used to the size of the lymph nodes and their positions. So that when you observe, when you feel, anytime you feel a lump, you go to differentiate a lump from a lymph node in the sense that the sizes will be different and their location will be different. So next thing we'll be feeling for the breast while lying down. Now step two, we will first the breast while standing. Step three, we'll be feeling for the breast while lying down. So this is where we're making use of the pillow I mentioned earlier. So you lie down. If you are starting from the left breast, you place the pillow under your left shoulder. Take for instance, I'm observing my breast now, starting from my left breast. So I will place the pillow under my left shoulder, still with my hands behind. I will use the pads of my three middle fingers of my right hand and then feel my left breast. Now, lying down makes the breast spread evenly on the chest. Thereby, you're able to access deeper tissues that you could not feel when standing. So, lying down will make you access those deeper tissues that you could not feel when standing. But when you stood and felt your breast. So, lying down and feeling your breast, it makes the breast spread evenly on the chest. So, the same thing you did while standing, the same way you went through circular motion from light to firm pressure, you do the same thing while lying down. So you start from the armpit region, cover the entire breast. Now, when you are done with the left breast, you move the pillow to the right shoulder, and then you do the same thing for the right breast, just as you did while standing. When you effect for the left breast and the right breast, you do the same thing from light pressure to firm pressure. Now, step four, checking our nipple for the step four. So you'll be checking the nipple, and then you'll be observing for some changes in the nipple. So how will we observe the nipple? You take your finger, your index finger, thumb, you encircle it around the nipple and then press. Now you are pressing to check for discharges. You are pressing to check if there are discharges from the nipple. And this discharge could be bloody, it could be clear, it could be colored. And there are discharges you should seek for medical assistance, you should seek for medical help, professional medical help. So you are checking the nipple for discharges, you are checking the nipple for change in shape. Change in shape. Change in shape could be the nipple pulling inwards, that's inversion of the nipple. Nipple pulling inwards into the breast instead of pointing outside. You are checking for discharge, you are checking for shape, you are checking for the direction of the nipple. Is the nipple, both nipples, are they pointing in the same direction and they are pointing in different direction? Both nipples should be pointing in the same direction. And then you should check the skin around the nipple. That's the dark area. It's called the areola. You should check the areola area and observe for redness, observe for rash, observe for crusting of the areola. So if you've done these four steps, you successfully carry out self-examination on yourself. Now, if you observe anything that is different from the normal, what should you do? Or what can you observe for you to be able to for you to say, okay, I need the help of a medical professional? When you observe a new lump, a lump that is different in size from the lymph nodes and is different in the location, position from the lymph nodes. A new lump, when you observe tinkling in the breast or in the armpit, when you observe that an area is thick, you should also seek for what professional help. Then also, when you observe unusual discharge from the nipples, you should seek for professional help. When you observe unusual discharges from the nipple, you see for professional help. When you observe there is redness in the breast in the nipple in the areola, you should seek professional help. Redness, rashes, crusts, swelling. When you feel pains that is persistent, a constant pain in your breast, you should seek for medical help. Now, what do you do if you find a change in your breast? What should you do? There is no cause for alarm. You should not panic, you should not be scared. There is no cause for alarm. Rather stay quiet, stay calm, stay calm. Go to the hospital. Do not wait for the changes to resolve on its own. Do not wait for it to resolve on its own. Don't say, na you know I stay reach there, you comot by yourself. Don't do that. Don't do like the normal African. Seek help immediately. Seek help immediately. Go to the hospital. See a doctor, see a nurse. Seek for help. And when you are going to the hospital, you could go along with a family member, with a friend, for emotional support. But it's very well needed. Now, the self-breast examination does not cover any other clinical examination that will be carried out for you. It does not replace other clinical examination. When you present in the hospital, there is other clinical examination will be carried out, such as mammogram, ultrasound, clinical breast examination, to still be carried out for you. Self-breast examination does not replace it. Self-breast examination only helps you detect changes in your breast, both positive and negative changes. It helps you detect changes in your breast early enough so that you can present to the healthcare facility very early. So now let's have a recap. Steps in carrying out self-breast examination. From step 1 to step 2, step 3, and step 4. So now for step 1, like the elder said, you look in the mirror. You stand in front of the mirror, you observe your breast, you observe the nipple, you observe the size, the shape, the symmetry, you observe for redness, for patches, for swelling. These are what you observe while standing in front of the mirror, and you observe with your hands by your side, with your hands above, and with your hands pressing firmly on your hips. And then step 2, this is where you feel your breast. You feel your breast. Standing under the shower, you feel your breast. You use your middle fingers, the parts of your middle fingers, and you feel for your breast, going in circular motion, using the parts of one finger, of one hand. The question you're starting from the left breast, you use the twin middle finger, the parts of the twin middle finger of the right hand to feel the breast of the left hand, and you go in circular motion, ensuring that you cover the entire area of the breast, starting from the armpit region to the entire area of the breast. So you do this under the shower so that you prevent friction. Now, step 3, you feel for your breast while lying down. You feel for your breast while lying down, placing a pillow under your shoulder. If you are starting from the left breast, place a pillow under your left shoulder. And then you also use the parts of your three middle fingers of your right hand to feel your breast, to feel your left breast, going in circular motion, starting from the armpit region. And remember to place your hand behind your head to expose the armpit region. Then step 4 will be that's where you observe me. You observe for discharges using your index finger and your tongue to press the nipple and to check for discharges. This discharge could be bloody, could be clear, could be colored. So you check for discharges, you check for rashes, you check for redness, you check for swelling in the breast, and you also check the dark area around the nipple. So that's that for self-breast examination. Remember, self examination helps you know what is normal in your breast. It helps you understand how your breast feels like. It helps you know detect changes early. These changes could be positive and it could be negative. These changes are positive in the sense that there are changes that occur in the breast with different changes in the hormonal levels. So now you are able to know these positive changes that are normal for every woman, and then when you observe some changes that are negative, that are not supposed to be, that are normal, you are able to seek professional help. Remember, early detection is key. When you detect these abnormal changes early, it makes you present to the hospital early, then it results to successful treatment. And remember that self examination is not for everyone. It's for both means. Thank you very much for listening, and I'm very sure you have questions. I'll be waiting in the comment section for your business. Thank you very much and have a wonderful. Bye. See you next week.